All right, we'll get started. Welcome, everybody. Thank you for attending today's town hall. Today, you're going to hear from UAB leadership, and afterwards, we will go to a Q&A. We have received some of your questions beforehand, so our leaders are poised to answer some of those questions in their opening kind of remarks. And just as a reminder, we are recording this session, so afterwards, if you want to revisit any of this content, please just visit UAB's YouTube channel. And then we'll also follow up with unanswered questions in an upcoming e-reporter, so be on the lookout for that. With that, I will hand it over to President Watts.
Thank you, Rosie. And thank you all for joining us this evening, and welcome. Before we get into some important updates and answer questions, I want to share with you my optimism for 2021. UAB has come a long way since the beginning of this pandemic. We've all worked hard to keep moving forward, and what we've accomplished in 2020 is truly remarkable. Thank you for doing your very important part throughout this process. Challenges remain for us as a university and the health system, but we are in better shape than most of our peers across the nation. I have great optimism for us in 2021 because I know that any challenge that presents itself, we can handle and we will successfully manage. We've learned so much about living, studying, and working safely during this pandemic. Public health and infectious disease experts continue to provide guidance that we build into our campus safety plan, and we will continue to make evidence-based decisions to guide our activity. We all have the power to make decisions and temporary sacrifices both on and off campus to keep ourselves and others safe. And now, finally, we have light at the end of the tunnel with the advent of the new vaccines. Your opportunity to get a safe and effective vaccine is coming, and you'll hear more about this tonight. Please look to official UAB communications for important guidance, updates, and information as we continue to navigate this fluid situation. The virus will be among us for the foreseeable future, so we must continue to practice all of our safety measures even after receiving a vaccine. And as always, continue to stay UAB United. Thank you, and I appreciate everything that you're doing on behalf of all parts of our mission each and every day. At this time, I'll turn it over to Reed Jones, CEO of UAB Medicine. Reed?
Thank you, Dr. Watts. As you obviously know, most of our energy and efforts are focused on COVID, treating COVID patients, vaccinating employees and whatnot. And I'll make my comments brief because we have our experts on the agenda today that are going to address that. But basically, the hospital is very full. We had 295 COVID patients today. The ED is really backed up, and the patients continue to come in. Our staff, our faculty are working very hard to treat these patients, but as you can imagine, they are feeling a lot of stress. They're really heroes. They're at the point of the spear, and they are working hard to take care of our patients, and I'm very proud of them. We were able to give a COVID differential to the units that are either exclusively treating COVID patients or have a mix of COVID and other patients, and we were happy that we were able to do that. There's been an amazing amount of coordination through this pandemic with local hospitals. The level of cooperation, coordination, and support among the hospitals has really been remarkable. And from everything I hear, it's a bit unique to the Birmingham market. So we have a call every week with all the hospital CEOs to make sure that we are working together. We commissioned just last night our CMOs to work together to look at our diversion strategies so that we can load a level a bit if things continue to get as bad as we expect that they are going to. Dr. Lauren Rue is representing us on that in that effort. On a very positive note, our alliance with the St. Vincent system is going very well. Obviously slowed down because of COVID, but we've commissioned a number of task force to look for opportunities there. And I'm confident that over the next several months and years, we're going to find opportunities that will benefit both UAB patients and St. Vincent's and their patients. So we're excited that those efforts are continuing to progress during the pandemic. But with that, I will turn it over to Dr. Benoit.
Thank you, Reed. It's nice to see you all. Thank you so much for coming today. I want to echo President Watt's thanks. We know that this has been an incredibly difficult time and required a lot of flexibility and change on your part, but you really have risen to the challenge. And it's incredibly important that we've been able to be excellent in all aspects of our mission. Our employees are so critical to being able to accomplish that. So let me echo his thanks as well. On January 4th, we sent out a message to the campus indicating that we had been looking very carefully at all the data throughout December, looking at the projections, and that based on all the data that we had looked at and the discussion with our public health and infectious disease experts, that we would continue into the spring semester, much like we were in the fall. A combination of different kinds of delivery formats, face-to-face, hybrid courses, the remote classes, the online classes, in order to provide our students with the best possible experience going forward. So one of the things that I know has been asked about is, given that we have an increase in the cases, more than we had last spring, why would we continue to go in this way? And part of that is because we really learned from the fall. We learned a lot about the virus in 2020. And considering the options for the spring semester, we consulted a great deal of data, trends, projections, listened to our experts about what might be the best way to proceed. And our plan for the fall semester really worked to maintain campus safety when we looked at all the data that was collected about what occurred in the fall. The current state of COVID, the projections require us to increase testing in order to continue to maintain a safe campus, and Katie Crenshaw will talk about that in a minute. We also learned through the fall that there were ways in which we tested that we needed to modify in order to be able to test more effectively going forward. And you'll hear Katie talk about some of those changes. But the experts agreed that the most effective approach, the use of resources to increase regular testing throughout the semester for more people, rather than even getting an entry test, was the best method forward. For some of you, this may mean that you'll be teaching in a different way than you taught even in the fall. And I want to remind you that there are lots of resources available to you. There's an incredible website that will let you see exactly what kind of technology is in each of the classrooms. There are workshops are available. There are workshops that are coming up in each one of the schools in order to allow you to talk with Angela Stowe from Student Health about mental health issues for your students and yourself, about how we integrate technology and mental health issues with Pam Poston and Scott Phillips. So look for those coming up in each one of your schools where you'll have a chance to ask questions there as well. And with that, I'm going to turn it over to Katie to talk more about the testing strategy for the spring. Katie.
Thanks so much, Dr. Benoit, and Happy New Year, everyone. My name is Katie Crenshaw, and I serve as the Chief Risk and Compliance Officer here at UAB, and also as the chair of the UAB Campus Incident Command Committee. Our committee is responsible for gathering and monitoring data related to UAB's experience with COVID, and then reporting that to leadership so that informed, data-driven decisions can be made about UAB's ongoing health and safety plan. As Dr. Benoit shared, based on our experience in the fall semester and everything we've learned, along with recommendations from our outstanding infectious disease and public health colleagues, UAB's testing plan for the spring is going to be enhanced and expanded. Our modified testing plan is designed to address current COVID-19 community trends, and further reduce the risk of transmission on campus, along with the masking and distancing and all of those other precautions built into our plan. There are 4 types of employee COVID testing, and we'd like to share with you today those in broad strokes, with additional information available on the UAB United website. The first type of testing is symptomatic testing. Employees who experience COVID-19 symptoms should report those on UAB Health Check. You'll be prompted to complete a more in-depth UAB employee exposure form for evaluation by Employee Health. If you're referred for testing, you'll be contacted by the UAB Access Center and scheduled for testing at the drive-through site at UAB Highlands Hospital. You'll receive follow-up from Employee Health with your results. Please note that this process is completely unchanged from the fall. It remains the same moving into the spring. The next type of testing is close contact testing. So this is for employees who are not symptomatic, but who have been informed that they have had a close contact exposure with a positive COVID case. That should also be reported on UAB Health Check. Here too, these employees will be prompted to complete a more in-depth UAB employee exposure form for evaluation by Employee Health. Because close contact is defined differently for healthcare personnel and non-healthcare personnel, it's critical that employees follow the instructions from Employee Health for next steps. For non-healthcare campus personnel, you'll receive a follow-up email instructing you to quarantine as a close contact for the requisite 10 days, and then also inviting you to test. This type of close contact testing is offered at UAB Kirkland Clinic and UAB Highlands Hospital by appointment only. It's important to keep in mind that close contact testing does not shorten the period of time mandated by the Alabama Department of Public Health for quarantine, but it does allow for further contact tracing of known positive cases. The third type of testing represents the biggest change from the fall, moving into the spring. We're calling it active sentinel testing, and it's going to be supported by the UAB GuideSafe platform. Active sentinel testing offers UAB campus employees who are designated by their supervisors as working on-site or in a hybrid capacity the opportunity to test every other week. Remember that we said we were increasing testing, so this is more than the randomized testing we offered in the fall, and is offered to employees every other week. It's completely voluntary, but we encourage UAB campus employees to take advantage of this testing resource. It not only supports your health and the health of your families, but it also helps further protect the UAB campus by quickly identifying and isolating asymptomatic positive COVID cases. And if that doesn't motivate you, there are also incentives like t-shirts and small Starbucks gift cards available to promote participation, at least while supplies last. So again, we encourage campus employees to take advantage of this. There are 2 steps that campus employees will have to complete in order to participate. The first step is to register with Verily, UAB's trusted testing partner. Beginning January 15th, campus employees will be able to visit healthy.verily.com to create their Verily accounts. Once you register, when active sentinel testing starts on January 19th, you'll receive an email from Verily notifying you that you have the opportunity to test. The email will contain the link you need to set up an appointment for testing at one of 2 designated campus locations. One is in Blazer Hall Residence Life Center, and the other is in Volker Hall. Days and times vary for those 2 locations for appointments, so please look to the email invitation or the UAB United website for additional details. Again, I'll note that UAB medicine employees will not participate in active sentinel testing in the spring due to their unique health and safety protocols. So they should continue to follow testing procedures outlined by leadership. And then the final type of testing for the spring is called for-cause testing, or sometimes hotspot testing. This is used when there are clusters of positive cases in a shared geographic location or work environment, and is ordered at the discretion of medical professionals. So individuals that would be subject to this for-cause testing or hotspot testing would be personally communicated by Employee Health. Testing for students is similar in some ways to what I've described here, but since we're visiting with employees today, we felt it important to focus on those that were most relevant to that group. And I recognize with the various types of testing and all of these different processes and locations that I just went over, there will likely be additional questions. So UAB Communications and Digital Marketing Strategy have developed some really helpful materials that are available on the UAB United website. One is a process map that actually follows on the next slide. And there will be additional updates in the UAB Reporter, so please stay tuned there. Happy to take any questions at the end related to our testing strategy. Again, this has been developed by our medical professionals and public health professionals in a way that supplements our other safety precautions. We believe poises us for success in the spring. With that, I will turn it over to Dr. Selwyn Vickers, Senior Vice President for Medicine and Dean, for his comments.
Thank you, Katie. I appreciate your comments, and I echo the hard work that Pam mentioned that many of us went through, particularly with she and Lori, to help design a testing strategy with you and others. I would remind them that in most of our cases of symptomatic tests of our employees, it largely did not occur on our campus. It occurred in the community. Now, that doesn't mean we by any means don't offer the test and seek to protect our employees, but it was part of the confidence from the data that we don't have a high transmission risk in our campus, particularly on the academic side, which gives some confidence for us returning. So that's important. The second piece that Katie mentioned that I'll just reemphasize is that we did a lot of testing, I think, in the first semester. But in fact, we realized there was room for more. And the plan that you hear is actually increased testing by a significant amount. To some degree, that almost every other week, if you feel like there's a test need, that opportunity exists in the active sentinel testing. And that's something we should be proud of, but take advantage of for those who still have concerns about their risk and their exposure. I think you'll hear in some detail from Suzanne that we're still in the midst of a very difficult time. Reed counted the number of patients we have at 295. We have 6 medical surge teams. So I really want to thank our faculty who have stepped up and volunteered. I want to thank our residents and our medical students who are helping with vaccines. At every corner of our side of the medical community, Reed and I and Ray see many of our faculty step up and choose to serve. And so it really is all hands on deck participating in a significant need that our city and our state have, particularly for when it comes to healthcare delivery. In addition, I really want to thank the leadership in the hospital. This time in April and in May, we had to shut down completely. And now we have a flexible model that allows safety for our patients who need care, for those who need COVID, but also safety for those who have procedures that need to be done, as well as some protection for our financial health. It's obviously not at the full level we like, but it's not completely shut off. And that's important for our community. As you know, the burden of disease that we face in this area is significant. UAB in many ways is the hospital of choice, and we want to make sure we still take care of all of those non-COVID illnesses. I also want to thank our doctors in the context of their care. It's evolved of how we've managed patients. It's evolved that we, in many cases, avoid intubation. We actually extensively care for people well to get them out. And we've taken advantage of the monoclonal antibody therapy as much as we can get our hands on. It has had a significant impact on keeping people out of the hospital when given early in their course of infection. So I'm appreciative of the ongoing work and effort to give the best outcomes for all of our citizens and our patients by our physicians and our staff and our leadership. I think you'll hear that we're breaching this number of nearly 5,000 cases a day, over 3,000 people admitted, positivity rates north of 30%. Suzanne hopefully will tell us some point in time when this will begin to go away. But I'm mindful that we're still in a very difficult period. We need to be thoughtful and continually be careful. You need to be aware that so many parts of our community, and particularly on the UAB campus, are really sacrificing and giving their all to take care of our citizens and to provide a great community for you to be proud of and for us to return to our academic campus and community. I'll stop with that and turn this over to Suzanne Judd.
Thank you, Selwyn. So there are a lot of different pieces and parts we can look at when we look at COVID. We can look at how many cases there are, case positivity rate, hospitalizations, percent of severity of illness, how many of those COVID cases are severe, how many asymptomatic people are testing positive. There's so many different data points. I always call it a data-rich environment because there's not a lack of data when looking at this. It can get really confusing if you're going to AL.com or CNN or whatever news source you trust when you hear the numbers that are presented because you don't know the context for how those numbers are generated. We look at the data every week, and the slide that you're about to see is one of the slides we took a look at to examine how cases relate to hospitalizations. So I want to take just a second to orient you to this slide. This is one of the slides that was presented in the group that Katie Crenshaw was talking about that meets regularly every week, sometimes daily, depending on what we're talking about that week. In this slide, the black line represents cases and the solid black line represents actual average cases. The blue bars are the daily reported cases. It's really hard to tell from this graph because we've got so many months of data, but you can see this very rhythmic dipping down of cases. It goes up and it comes down and it goes up and it comes down, and that's very regular. Those dips are typically Sundays and Mondays because less testing is done on Saturdays and Sundays. So if you're reading AL.com and you're getting your case updates from AL.com, you might read 2,000 cases one day and 5,000 cases the next. That's because we test fewer people over the weekend than we do during the week. And the cases are reported about one day after the people are tested and get their results. So we see this very cyclic rhythm. So we tend to not look at daily cases. We like to look at the average cases. That again is that solid black line. Under the solid black line are hospitalizations. And these are total hospitalizations for that day across the state. The orange line you can see follows pretty rhythmically with the black line, and it's at a slightly different scale that is missing from the right that I forgot to include. They're not quite at the exact same scale, but you can see it's slightly under where the case line is. This has been extremely consistent since the summer. In the early part of the epidemic, March, April, May, you see the orange line above the black line. The orange line is above the black line because we weren't doing as much testing. And when we weren't doing as much testing, we weren't finding all of the cases. So this just means that we didn't catch as many cases. I want to walk you through a couple of the peaks that you see on this curve so you get an idea for how we can estimate what we're going to see over the next few weeks. The first big peak that you see occurs right around the end of June, early July. This was the holiday peak that resulted from Memorial Day and 4th of July gatherings. Like Selwyn mentioned, the bulk of transmission when we've seen big transmission leading to large case growth has occurred at smaller events, not large events. The second really tiny blip that you see on the black line occurs right around August the 30th. This corresponds with the universities going back. Both Auburn and Alabama, which have very large student populations, reported large numbers of cases in the first 2 or 3 weeks of classes. One of the interesting things about this particular blip up is that you'll notice that the hospitalizations did not go up following the blip up of the cases, nor did the cases stay at a sustained high level. This means that there was an outbreak among the college populations, but it did not translate into the general population. Now, other media sources have reported that certain college towns did observe transmission from the universities into the general population, but we did not observe that here in Alabama. There's actually a third peak that's nearly impossible to see on this graph. When UAB students had a small peak up, our peak up among students occurred right at the end of finals from the first midterm point roughly. And it's a really tiny peak that you can barely see, but it occurs right around mid-September. And again, there was no corresponding hospitalization peak following that peak. The next peaks that you see as it starts to climb up, you'll see a Thanksgiving peak where it makes a big jump up following Halloween to Thanksgiving. And then you see the results of the Thanksgiving and the Christmas peaks. You'll also notice that the black line is extremely messy. It's all over the place, up and down. And that's because we don't do as much testing as a state over holidays. So when you see it dip down, the dip down is just because testing wasn't done. It doesn't mean that there weren't cases out there circulating, it just means that fewer people got tested. You'll notice the hospitalization curve does not follow those dip downs. That indicates that the cases really remained quite high, but probably the less symptomatic people just did not go out and get tested. What we're estimating, and this is based on what we've observed in Alabama in the past, we've observed that holidays are what drive large case numbers. Again, the Memorial Day, 4th of July, those holidays really drove us a peak in cases. So we're estimating that the last big holiday was probably around January 1st. It takes about 10 days for the cases to work their way through the population, and then about another 10 days after that for them to start declining again. So the gray dotted line are the estimates for what we think is going to happen should the case numbers follow what we've observed in Alabama in the past. There are a couple of outliers that we're keeping our eye on. One of those is K-12. You'll notice that the cases really started ramping up right around mid-October here in Alabama. And one of the things that drove that was the fact that kids were back in school and we were getting transmission from children to parents. So we're going to have to very carefully watch that situation to see how that unfolds as the schools have already gone back and will continue to go back next week. The hospitalization curve is an estimation based on the estimated cases. But if our trends follow what they've followed in the past, we can expect that by roughly the end of March, we should start seeing case numbers go down to a point where we're very comfortable, where we've been in the past and been able to manage very, very comfortably. Hopefully we're getting close to the peak too. Hopefully in the next 5 to 10 days, we'll be able to see that the case numbers are really leveling off and coming back down the other side. Again, we'll keep our eyes on some big community events that we know are happening. There's a national football championship and people may get together and have small social groups of 10 to 20 to have watch parties. That could drive community transmission. And then K-12 being back in school. That's another thing we have to watch very carefully in the next week to see how those two events impact the cases here in Alabama. So those are the data that we have. And with that, I'm going to turn it over to Dr. Knapziger.
Well, thanks, Suzanne. You know, after hearing that very sobering news, I get to follow that up with what I think is some very, very exciting news, and that should be reassuring. So it's my privilege to be able to talk to everybody about COVID vaccine. You know, a month ago, almost to the day, is when we found out that we were going to be able to receive some COVID vaccine doses here at UAB. And that was absolutely a very exciting day for us here. We found out that our first allocation would be just under 11,000 doses, and we were very happy to learn that. As many of you are aware, that allocation did come with a lot of strings attached. We have to allocate that vaccine in a way that the Alabama Department of Public Health advises us to do. That's a requirement for us receiving the vaccine. So we've done that, and we have to essentially play by their rules as we administer the vaccine. So I'm going to talk to you about how we've done that and give you an update on where we are, because I know you all have a lot of questions about it. Since that initial allocation, we did receive those doses of vaccine and have been administering them. And we've also received word that we're going to receive 2 additional allocations so far. The second one we found out about on New Year's Eve. It's going to be around 6,800 doses. And the third one we just found out about a couple of hours ago. That's going to be an additional around 2,900 doses. So that is fantastic news. We're so excited. Now, all these doses I'm telling you about, these are first doses. Every time they give us an allocation, it comes with a promise that we will receive the matching booster doses that go with that allocation. So far, we've gotten our initial 10,725 doses, and we did receive the booster doses that go with that allocation. We got those in this week, and we just received a shipment notification today that our second allocation of 6,800 will be shipping soon. So We do believe that the doses are coming. We definitely already have that first allocation and the boosters in hand, and we're administering them. So that's all really fantastic news. So let's talk about where we are so far with vaccine administration. When we found out that we were getting vaccine, like I mentioned, we had a very short timeline to stand up a massive vaccine program. When we found out we were getting almost 11,000 doses, that was 10 times more than we thought we would receive initially, because we were really planning to vaccinate our employees at UAB. But the health department had other things in mind for us. They said, no, we're going to definitely give you a lot more vaccine, and we want you to vaccinate your employees, but we also want you to vaccinate a lot of other people in your community. So we had to stand up an entire vaccine program, not only for our own employees, which we were pretty, we felt pretty good that we could do that, even though it's quite complex. This is not like setting up flu vaccines. It's a lot more complicated than that. But we also had to set up a system to let people from the community make appointments and come in from various different healthcare organizations. So just a lot of moving parts and a really big project that got set up very quickly. So we've been pleased with the way it's gone. How's it performed? Well, as of this morning, we'd already administered 12,307 first doses and starting to get into some second doses. So it's going quite well. When we first started, the first couple of days, we didn't schedule as many people per day. And we had two separate sites set up, one in our Margaret Cameron Spain auditorium in the Spain Wallace building. And the other was a drive-through site at our Highlands Hospital parking deck. Now, a lot of you are familiar with that parking deck because that's where you go when you have symptomatic testing. That's the same place you go. And so we were using that deck in the afternoons for some drive-through vaccines. So what we learned from those experiences is, number one, definitely we can do vaccines in both locations. The Highlands drive-through site worked quite well, but it's a little bit limited in the volume that we can pump through it every day. And the reason for that is after you give vaccine, you have to watch people for 15 minutes afterwards. So if you think about how many cars we can park in that deck at one time and observe patients, we can only park 100 cars in that deck when it comes down to it. So the bottom line is we're a little bit limited in the volume we can pump through that deck, but it can be done. That's a very important lesson that we've learned, because as we think about moving forward when it's time to vaccinate our elderly patients and people who are very high risk in the community, we're probably going to use some of those drive-through strategies for those patient populations. But what we decided to do for employees, thinking about our other site, is our Margaret Cameron Spain auditorium site has worked far more efficiently than we even dreamed it would. We're able to vaccinate well over 1,000 people per day through that site, and it's gone quite smoothly. I know many of you on the call probably have already been through that site and experienced it, so you know that it does go quite rapidly. So we've been pleased with that, and we've decided to pivot our operations to really focusing on use of that site so that we can be as efficient as possible with our vaccine administration. So since doing that, kind of where are we right now with vaccinating UAB employees? As of this morning, before we started working today, we had administered 7,700 doses to UAB employees. That's first doses. And then we had administered another 4,607 vaccine doses to employees of other healthcare organizations. And, which organizations did they come from? Well, all over the county, other hospitals in our county, and some outside of the county. They came from Cooper Green, from Jefferson County Health Department, from our federally qualified healthcare centers, from just a lot of different places, a lot of people from private doctors' offices, you name it. So we were required to share broadly, and that's exactly what we did. EMS providers were a big target of that too. So to summarize that piece of it, it's gone quite well. So let's talk about the effectiveness of the vaccine right quick. A lot of people say, hey, how do we know this is effective? I know we've talked about this at length before, but we do think it's a very effective vaccine. After 2 doses, greater than 95% efficacy, and that's almost unheard of with vaccines. So we're really excited about that. How long does that immunity last? We don't know. It hasn't been around long enough for us to know. We do know that in the patients who were initially vaccinated with these vaccines, their antibody levels where they're testing them still remain high. So we're hopeful that it's going to last for a really long time, but we just don't know yet. That's something certainly we'll be watching. So the next question people ask me is it safe? And we think that it is. The data from the FDA, from the manufacturer, all show that this vaccine is very safe. And we're talking about the Pfizer BioNTech product. That's the one that we're receiving here. The data looks great. And our experience here at UAB so far looks great as well. As I mentioned, we vaccinated well over 12,000 people, and we systematically collect data on each one of these people. We send you a survey after you're vaccinated and ask how you're feeling at 24 hours and then again at 7 days. And so far, what most people report is they may have a sore arm. A few people have some mild flu-like symptoms, maybe some myalgias, fatigue, a little joint pain for the first 24 hours. And then when you look at the 1 week data, really nobody has symptoms at 1 week after vaccination. So we're feeling really good with our safety data here. We haven't had anyone with a serious adverse event. No allergic reactions. So we're really pleased with how the safety data is shaping up at this point. All right, so let's talk about where we are in rolling out vaccine to different groups. As I mentioned to you, we have to play by the rules that the State Department of Public Health gives us in administering this vaccine, and we are in what they call phase 1A. They have different phases that are prescribed, and 1A is where we are right now, and that includes healthcare workers and long-term care facility residents. Well, we're not really vaccinating long-term care facility residents from UAB Employee Health, so I'm not going to talk about that piece, but just know that that's happening in other sectors, but we're not really talking about that today. So who we're vaccinating right now is healthcare workers. And the way we started our process is we had directions about who to focus on first. And it's things that really make the most sense. It's the healthcare workers who are taking care of COVID patients on the front line. So our emergency department workers, our COVID unit staff, people like that who are actually taking care of patients in the hospital with COVID and in the outpatient setting. Those are the people that in general were targeted first to receive the vaccine. Now, we did have a committee that looked at the sequencing of the vaccine and had review by our ethics personnel of that. But I just wanted to assure you that this was not something that we took lightly. It's something that we put a lot of thought into sequencing to making sure that it was fair and equitable. A lot of people said, well, I think you should just vaccinate all the doctors and nurses first. But those of you who work in healthcare, I don't have to remind you that healthcare is a team sport. There are a lot of us who work here every day. It's not just doctors and nurses. There are a lot of people who work to deliver healthcare. A lot of people from different walks of life come together to make the healthcare happen here. So we took a broad focus. We're vaccinating our environmental services workers, our food nutrition workers, anybody who is at risk and coming into contact with these patients is who we focused on first. Respiratory therapists, physical therapists, you name it. There's a lot of people that work here that we focused on. We did get permission recently from the state health officer to include our clinical-based students in the healthcare worker population. So we've been working with the deans of those schools to identify those students and to get their information so that we can extend invitations for vaccination specifically to those students. So that is a very new thing that has just happened in the last couple of days as well. So I want to talk to you about the invitation process for how will you know when it's your turn. The way we started this is we did want to target those people taking care of COVID patients first, is we used an invitation process. We identified groupings of employees through human resources and got their names from them and extended email invitations. So people received an email in their work email with a link in it for them to register to receive vaccine. So that's where we started because we knew we had a lot of people that we wanted to vaccinate quickly, and we wanted to make sure we got the folks working in those COVID areas first. So we've moved through that quite rapidly. And 2 days ago, we were able to open up an all-call process for healthcare workers. So many of you may have seen this in your email already. If not, you'll be seeing it soon. We sent out something that defines who healthcare workers are, which people are eligible to receive vaccine right now. And there's a link there. So if you're a UAB employee and that applies to you, you'll be able to go in on that link and sign up and register to receive vaccine. Now, after you register to receive vaccine, we use that information to schedule you an appointment, and you receive an email back with your appointment time. Once you receive your appointment, there's a methodology for you to change that if you need to, but we're asking individuals to try their very best to make it to their appointment time so that we don't have to change it, because anytime we have to change it, it slows things down. It's extra work for us. And our whole goal here is to be fast. We are all about efficiency and speed because we want to have everyone vaccinated as quickly as possible. We don't want any delays, which kind of brings me to my next point. I know a lot of people have had some heartburn and complaining about the sequencing of vaccinations. And I've heard from a lot of individuals who've said, gee whiz, why did that person get picked? I think that maybe I probably should have been picked before them. And, you know, a lot of people have some concerns and commentary about that. And what I want to say is this, is our sequencing perfect? No, it's not. We know it's not. UAB is a very complex place. A lot of people work here. We have lots of employees. Many of us have first and secondary assignments, and our HR groupings are going to be a little inconsistent based on that. We knew that going into this, but here's the thing. We knew that we could get the sequencing absolutely perfect, or we knew that we could just roll this out and get everyone vaccinated very quickly. And we chose the second because we didn't want to delay anybody's vaccinations. We wanted to roll things out quickly. And do we feel like we got the sequencing very good? Yes, absolutely. It's good. Is it perfect? No, but it's really close. And the bottom line is that we're getting everyone vaccinated very quickly, and we're very pleased to be able to do that. So thinking about moving ahead in the other phases, the next phase is phase 1B, and that phase includes people who are over the age of 75. It includes first responders, people who live in congregate living settings like prisons, things like that. And then a big category of people called frontline essential workers. And that actually has a very specific definition of who those people are. It includes corrections officers, firemen, police officers, people who work in food and agriculture, U.S. Postal Service, manufacturing, grocery stores, public transit, child care workers, and finally, education sector. So that's where the remainder of campus will fall. When we get to that phase 1B, we'll be able to offer vaccinations to everyone who's a UAB employee, regardless of whether you're in the healthcare setting or not. So we're trying to be as liberal as we can in our definition of healthcare workers so that we can go ahead and vaccinate as many UAB employees as possible while we're waiting on the green light from the State Department of Public Health to move into that 1B category. So we're trying to be very liberal with who we say is a healthcare worker, just so we can go ahead and vaccinate as many of you as possible. But when we do get that green light from the Alabama Department of Public Health to move into that education sector, as soon as we do, we're going to complete the rest of campus. When will that be? Well, I don't know. I can't tell you an exact date because guess what? It's not up to me. I can tell you that we are moving quite rapidly through all the healthcare workers who want to be vaccinated, and we could possibly have them all done in another week. So I think that to give you an exact timeline, I can't do that, but I can tell you, by the end of January, as long as we get the green light from Alabama Department of Public Health, we should be able to offer vaccination to all of you. Can I give you an exact date on that? No, I can't, because once again, it's not completely up to me. But we definitely want to get everybody vaccinated as quickly as possible. So a couple of other things that I just wanted to address, because people have asked a lot of these questions, and I know some of you may have more, but maybe I can address some of them before I conclude my comments. A lot of people have asked if this vaccine is mandatory. No, it's not. We don't feel like we can make it mandatory at this time. It's on an emergency use authorization license from the FDA, and it's brand new. So we don't feel like, in all fairness, we could mandate it. However, we are highly encouraging all of our employees to receive it. We want to keep you safe. We want to keep your family safe. We want to keep our campus safe. So we want everybody to get the vaccine, but it's an individual decision for sure. A lot of people have asked about standby availability. What do you do at the end of the day if you have extra vaccine left? Well, this vaccine requires special storage and handling. And remember I told you it's different than flu vaccine by far. It requires a lot of special things to be done to store it. It has to be stored at -80 degrees Celsius in special freezers. You have to monitor that. And then it comes in a powder in a vial, and you have to mix it with a diluent and withdraw it from the vials. And then once you mix it, you have a finite amount of time before you have to waste the vaccine. So we never want to waste a dose. We haven't had to yet. If we've got vaccine mixed, we're going to find somebody to give it to. So what do we do if we've got extra doses of vaccine at the end of the day? Well, we find people who are in that phase 1A grouping. We've called and said, hey, emergency department, I've got some extra doses today. Do you have anybody there who's scheduled who hasn't received their vaccine yet? And they'll send a few people over. We may have 5 doses or 10 doses. So I will tell you that there were a couple of days over the holidays when we did have some trouble filling our schedule for vaccine. A lot of people, I think, were not checking their email and missed their appointment times and just did not accept their appointments. And so there were a couple of days over the holiday that we did have to call more broadly for people to come in for standby availability because we did not want to waste doses. And so how did we do that? We called the clinical leadership teams, we called the leaders and asked them to send people who were in those target groups to us to be vaccinated. Now, once again, is it perfect? No. Do I think that have there been times when maybe somebody showed up and got a vaccine who maybe shouldn't have been included in one of those target groups? I can guarantee you that probably has happened because I know we're not perfect. We can't police it to that level. And we know sometimes people may not always be 100% truthful about where they, what sector they fall in and where they work. Have we done that on a broad scale? Absolutely not. There have been very few people who should not have been vaccinated yet who have received one. Very few. And by that, I mean maybe less than 5. So it's just not something that's happening on a broad scale, regardless of what you may have heard. So a few other questions that I want to address. Some people have asked if we need to have an antibody test before receiving the vaccine, or even if they could have an antibody test. And I'll tell you right now, that's a service that we're not offering because it doesn't change anything. Even if you had high levels of antibodies, we still want you to receive the vaccine. That is the guidance from the CDC right now. That's what they want you to do. And so we're respecting that guidance and we're not doing antibody testing at this time. The CDC also has recommended for people who are COVID positive that we wait 90 days before we vaccinate you. The reason for this is very few people have a COVID reinfection within 90 days. And also there is some concern about those individuals having an exaggerated response to the vaccine. So we want to wait 90 days for that. In addition, a lot of you, if you have a high risk condition, if you have COVID, you're going to receive monoclonal antibody therapy. And definitely we cannot vaccinate you if you've had that within 90 days. So we do try to wait that 90-day period if people have been COVID positive. So I know some people have had a lot of questions about that, but everybody will have an opportunity to get their vaccine. If you miss your chance now because you had COVID last month, that's okay. Don't worry about it. You're going to have a chance to get vaccinated. We've had a lot of questions from people who are pregnant or lactating, and the guidance from the FDA basically leaves that decision up to the individual, and we're respecting that as well. We don't have great clinical trial data on these vaccines in women who are pregnant or lactating because they were excluded from the studies. However, the experts in the Society for Maternal Fetal Medicine and our infectious diseases experts feel that this vaccine is safe in those populations. We provide that information. It's all in the handouts that are given to employees, and we allow each individual to make their own decision about whether or not they want to receive vaccine. So we're not excluding pregnant women or lactating women. Based on that, we do allow them to make their own decision. A couple more points before I'll hush. A lot of people have asked me, what about health check? Do I, let's say I get my vaccine and I feel a little yucky the next day. Do I report those symptoms in health check? Well, we know that you're going to have some side effects from vaccines. Some people are. And we ask that you not report those anticipated side effects for the first 72 hours after after vaccine. We still don't want you to come to work if you have a fever. So definitely if you have a fever, please don't come to campus. But if you have just the expected side effects from the vaccine, some mild fatigue, mild joint pains, malaise, things like that, we don't really need you to report those in health check if it's in the first 72 hours after vaccine. Now, if it's beyond the first 72 hours, we do want you to report that. After you get vaccine, you still have to wear a mask. And the reason for that is we don't know if you could be an asymptomatic carrier still. Data's not out there. We just don't know yet. So you still have to wear a mask. I'll close my comments by saying this is everyone who wants to get the vaccine is going to have an opportunity very soon. We are moving very quickly. We have around 23,000 total employees. We're able to vaccinate over 1,000 people per day. At that clip, I can tell you we are going very quickly. We've already administered, like I said, over 12,000 doses. We're going to get to everyone super fast. So y'all hang in there. Everyone's turn is coming. Stay tuned to the media channels, and we'll be letting you know when it's your turn and give you information on how to sign up. I'll stop there. Thank you.
Thank you. That was really important information. Thank you so much, Dr. Nafziger. At this time, we don't have a lot of time, but your questions are pouring in. And so I'm going to try to ask the ones that are being repeated. So in regards to vaccine information, Dr. Nafziger, people are asking about, is it safe if they're immunocompromised? Could you talk about safety of the vaccine for people like that?
Sure. We do believe that it's safe for people who are immune compromised. There's no specific exclusion. The only people who are asked not to receive the vaccine, other than the ones we mentioned, are people who have had a serious allergic reaction to any prior vaccine. Those are the only people who have been asked to not receive it.
An individual asked, will vaccines be available for spouses of UAB employees when the employee is eligible for vaccination?
Only if the spouse is an employee. So right now we don't have any allocation for the general public, which is what spouses generally would fall into. But when they become available for patients in the general public, certainly that messaging will go out. So we'll be sure and let you know when that's available.
And there are several questions. Dr. Benoit, maybe you could best respond. People are looking at Dr. Judd's data and concerned about our decision to have on-campus classes or go hybrid and remote. So maybe you did address some of that, but maybe you could follow up a little bit about our rationale for doing this.
I also want to reiterate what Dr. Vickers said, which is one of the things we learned in the fall is that the rate of the transmission is very low in the classroom. So through contact tracing, we're able to determine that cases that we were seeing from people who worked on campus or students on campus were really acquired off campus. They were acquired in these small group settings or during holiday times. And so one of the things that we really considered very carefully is, given that the classrooms are in fact one of the safest places that students and faculty can be, how do we make that even safer by expanding our testing program to allow us to pick up those cases that may have been acquired outside of campus and make sure that those students and faculty are isolated or quarantined so that it doesn't continue to spread. Someone, do you want to add to that, or Suzanne?
So Pam, I would add, I would have everyone know the Health and Safety Committee, which the leaders on this call, including Dr. Benoit, were part of extensive conversations with clear willingness to go fully remote if we had data to support it. But in reality, we saw over our lesson of last year that on our campus, because of the areas that we had taken significant precautions and followed the public health standards, it was a clear place where transmission did not occur. Unfortunately, we saw continually for clinical students, employees, and regular academic students that it was the activities outside of our campus that drove this. So the data didn't give us logic not to return. The data gives us logic to still challenge people how they behave in the settings outside of our campus. Mask, groups, and interactions that run the risk of increasing the virus are the things that we still need to emphasize. But it didn't support that occurring on our campus, independent of the data you saw on CNN and what's going on right now. It hadn't occurred on our campus.
Suzanne, what about your, because I know we consulted very heavily with you and other public health experts. Talk to us a little bit about how we use that data to come to this conclusion, because I know you were very supportive of this, but only if we expanded the testing protocols.
Yeah, absolutely. The testing is the most important leg of our stool this semester. After the masking that we're already doing a great job of on campus and the social distancing, the new testing plan is the new leg of the stool that's going to help us identify cases more rapidly and help those people get into isolation so that they don't transmit it in their social settings. Because again, even among students, when we saw transmission, the transmission was not occurring in the classroom. It was occurring in study groups that were getting together off campus and maybe not following their masking guidelines, or riding in cars together, or having a social event together. So we want to make sure to identify those folks that are testing positive as quickly as possible so that they don't spread it beyond their social group. We saw almost zero transmission that we know of from contact tracing from student to faculty, from faculty to student. So we really, our data show that that is not going to help us control this epidemic. And when you look at that peak, I read some of the questions saying the peak is coming. It's really not that much higher than where we are today. It's just a blip above where we are today. We're getting close to the peak, and we may be there right now. We'll know in the next 3 or 4 days the result of the July or the January 1st get-togethers. So that was what drove us. Also, the fact that we were able to manage smaller outbreaks that we had on campus. If you watched our campus numbers, we were able to rapidly identify students that were infected and get them isolated and keep it from spreading so that we didn't have a massive outbreak on campus. And so those were all of the factors that went into our decision-making to bring students back. It's really driven by the fact that transmission's not occurring during UAB-sponsored events.
Dr. Benoit, we've received a lot of questions from faculty asking if PPE would be provided for them if they're teaching on ground.
So I know I saw some questions about if you are now teaching face-to-face or hybrid, and you hadn't been doing that last semester, do you have access to PPE? And the answer is we do have some extra PPE. The first thing I would recommend that you do is to check whether or not your dean's office has any extras. And if they don't have the dean's office, contact my office and we'll try to get some over to them.
Great, thank you. We have a question about the GuideSafe app. So Dr. Carver, somebody asked if they've gotten notifications from the GuideSafe app that they've been exposed to someone who's COVID positive, but then when I visit the possible exposures tab, no exposures are listed. Is this a known bug?
It's not a known bug. If the person who put the comment was anonymous, if they'll just email me, we'll chase it down and find out what's going on. And my email is just carverc@uab.edu. I'm easy to find, but email me and we will help you out.
Great. And there are lots of questions about the viral just mutating, virus mutating. So I don't know if Dr. Vickers, you wanted to respond. People are worried that the impact of that.
Yeah, the data right now early on in animal studies show that the vaccines are effective against the mutations. It hasn't clearly been studied in humans yet, and hopefully that will come. But the reality is the mutation does appear to be more effective. But the virus, the vaccine as it's designed is targeted toward the S protein of the spike protein, the S segment of the spike protein, still seems to be effective. I think we've also seen in those cases where people who got the vaccine and still got infected, it was protected from them getting severe COVID-19 and the side effects. The final thing that I'll mention that probably is not often thought about, and Sarah has seen this on multiple occasions. When you get the vaccine, there is no magic that happens that day. It's typically a 10 to 14 day window before you get antibodies. And all of the studies didn't start counting the effectiveness of the vaccine until 2 weeks after the dose. So there have been plenty of people who've gotten their vaccine and in the next 3 days gotten infected because the vaccine hasn't had a chance to generate the antibodies from that dose. The first dose can be as high as 80% effective, but it takes 10 days to 2 weeks. So don't assume the vaccine doesn't work, but don't do behaviors that are unsafe just because you got that shot that day.
An attendee asks, if we get vaccinated, is sentinel testing necessary or should we still get tested?
Was that me? That's me. Right now, we have not changed our recommendations for testing based on receipt of vaccine, but that's a question we'll answer in the future as we know more information. But for right now, we're still recommending participation in sentinel testing, even if you're vaccinated.
We are out of time. Your questions are noted, and we will share that with leadership and get answers to your questions. And so look for responses in the next e-reporter. With that being said, I'd like to pass it over to Dr. Benoit and Dr. Watts for some closing statements. Dr. Benoit.
Let me unmute. So I just want to say again, thank you. You've got great questions. They're questions that we've been asking as well. And as you can see by the people who talked today, there's been a lot of planning, a lot of thoughtfulness about how to do the vaccine distribution, what to do for classes, how to provide resources for you. We're here to help. We all want this to be an effective semester going forward. And I know I'm really looking forward to the day when we can see this in the rearview mirror.
Well, I am too, Pam, and I want to say thank you to all the presenters tonight, especially Dr. Nafziger for handling all that multitude of questions. Everybody's so interested in the vaccine and how it pertains to our community and how it pertains to them. But I want to say thank you to all of our faculty and staff for the great work that you do every day on behalf of our very, very important mission to serve the people of Alabama, the people of our country, and people around the world with the work that's being done on COVID and other serious diseases. So thanks for joining us and have a good night, and I hope you have a good weekend.
Thank you.